ADHD, attention deficit hyper disorder, is one of the most common childhood disorders and continue through adolescence and adulthood. Symptoms include difficulty paying attention, staying focused, and controlling your behavior. ADHD has 3 subtypes: predominantly hyperactive impulsive, predominantly inattentive, and combined hyperactive, impulsive, and inattentive. If you are predominantly hyperactive, you would have 6 or more symptoms in the hyperactive category and 6 or less symptoms in the inattentive category. If you are predominantly inattentive, you would have 6 or more symptoms in the inattentive category and 6 or less in the hyperactive category. Or if you are combined, which most children are, you have 6 or more symptoms in both categories. If you are hyperactive, your symptoms would be you fidget a lot, you squirm in your seat, you don't sit still, you talk nonstop, you dash around and you touch everything, you have difficulty doing tasks. If you are inattentive, you are easily distracted, miss details, forgetful, you frequently switch activities, you become bored, difficulty focusing, you don't listen when you're spoken to, you daydream, you're confused, and you have difficulty processing information and following instructions. If you are impulsive, you're very impatient, blunt, you act without thinking, you don't wait, you cut in line, and you interrupt. Scientists are not for sure of the cause of ADHD. They think that a gene might play a part, or like other illnesses, many factors could play a part, such as environmental factors, social factors, possible brain injury, or nutrition. Those could all be factors as well. Some children carry a particular version of a gene, and these children are usually diagnosed with ADHD. This gene causes the brain tissue to be thinner in the areas of the brain associated with attention. But as children grow, the tissue becomes thicker and the ADHD symptoms decrease. The average age to be diagnosed with ADHD is 7. You can be diagnosed as early as 3. The 4.1% of the population, 18 and older, are diagnosed with ADHD. 9.0%, 13 and 18 years old, are diagnosed. And boys are 4 times more likely than girls, and the cause of that is not for sure. The percent of ADHD is increasing, and again, they are not sure why this is. Many children do get diagnosed very early and very quickly without doing a huge amount of tests. They might just be naturally hyper or naturally active, or have a different personality or temperament than the next child. All children get distracted or act out at some point. There is no one test to diagnose ADHD. A mental health professional has to come in and ask a bunch of questions and get history on the patient, gathers information about them, and use process of elimination to diagnose. Some common illnesses associated with ADHD could be a learning disability, oppositional deficit disability, which is when you're overly stubborn and you refuse to follow the rules. Conduct disability is when you lie, cheat, steal, bully. Anxiety and depression, bipolar, Tourette's, which is not likely in children, but possible. And treating these may decrease ADHD symptoms. Adults can also be diagnosed with it. Again, they would be overlooked by a mental health professional. They look at other symptoms because they tend to be varied and not as clear-cut as in children. Look at your history, and you must have symptoms that began in childhood and have continued through your adult life. And if you do get diagnosed as an adult, this could answer many questions that you had as a child, like why did you do certain things and why you acted a certain way. For treatment, the treatment purpose is to focus on decreasing symptoms of ADHD and increasing your function in daily life. You could be on medication, psychotherapy, education and training, or a combination of two or more. There is no cure for ADHD. You just want to decrease your symptoms and make living possible. Most cases are treated with meds, and researchers are developing more effective treatments such as brain imaging to better understand ADHD and ways to prevent it. If you are on medication, you could be on one or more of 17 different types. They are all called stimulants, which you're probably wondering why a stimulant would calm someone with ADHD, but that's just the effect it has on the body. Adderall and Ritalin are two of the most popular. And what might work for one children might not work for the next. You might have to go through multiple medications to find one that you find that works. Not all these are effective in adults. They're not recommended for adults because they interact with other medications such as blood pressure medicine, diabetes medicine. Some antidepressants are used in adults. They suppress the ADHD symptoms. Side effects for these medicines are decreased appetite, sleep disorders, anxiety, irritability, and some also have stomach or a headache. The side effects are minor, and if you decrease your dose, then the side effects usually decrease as well. Tips for adults that have children with ADHD: keep them on a schedule, every day the same schedule. Organize everyday items such as your toothbrush and your homework and stuff like that. Be clear and consistent. Give praise when they do something good. And although living with ADHD may be difficult, there are steps you can take to make living better. Diagnose it early, and keeping it under control is ideal. And if you do that, you should be able to live a happy life and not let ADHD take over.